So this video is specifically for the person that had emailed me this. It was a very long email and it was a few questions that I want to answer. So if you see this video is specifically for you. I'm just not gonna say your name. I just wanted to have a video versus an email because I feel like it would be better to explain. So let me just cut right to it. The first question that you asked, was it hard for me to catch on to the things that they taught me? You have to realize when I came in, I didn't even know what this job position was. I had never worked in a hospital. I didn't know one thing from another. So having literally no previous knowledge, I don't know if that was just an advantage, because if you don't know anything, it's easy for you to learn from scratch, teaching a baby how to learn a language. But when they were first teaching me, or I was just seeing everything at once and they were teaching me bit by bit, overall it was not a bad overwhelming, but the feeling of I don't know what none of this is, I can't really connect the dots and have a full understanding and comprehend everything that's going on, because there's so much that I don't know, but I want to know what this shit is. It was one of those. So it was basically I was so overwhelmed in a good way with not knowing everything, that I was so just okay, we're just gonna take this piece by piece, and by that I mean whatever they're showing me, they probably know best how to train you to what order, or to how to show you small things or certain things at once. And I was just kind of picking up and practicing. The very first thing that I did that kind of is I guess the most basic thing was wrapping. So they taught me how to wrap things, because we have different sizes. You have the 48 by 48, 36, 30, 18, 24, whatever. And you have different sizes of, certain things. So it's just stuff like that where it was I would practice. Literally, I was just rewrapping and wrapping and wrapping things over and over. And it's something as simple as doing a tray. I think the suture tray was the one that I picked up because we had it so many times, but also they were letting me practice it. So it's really just a matter of, you might not know what you're doing at the moment, but the more and more you practice it, and the more and more they're telling you about it, or you might have a story for some things, you're able to relate what you're learning and how they're learning for the future, so that it makes sense. If that makes sense. Let me just start over. Basically, no, it was not hard. And the people that I work with, they were very patient. They weren't really, no one was irritated and mad. If you have questions, it was just a welcoming environment, which was the first thing from the start. They were eager to teach me, and I was eager to learn. That's why it went so easy, and I was picking up stuff so fast too. So I really think that your environment may impact you, because if you're in an environment where you feel pressured, or you're not comfortable or whatever, you're not really, I feel like your mind, for one, might not even be focused in retaining the information that you're getting, but you also may not learn as quicker if it's not a growing or a learning environment. Obviously, I'm hoping that that's never the situation for anybody, but I definitely would say that not being afraid to ask questions. And I also feel wherever you're confused at, because you don't know what you don't know, you don't know what you know, okay? So if you are ever confused by something, stop it there, because if you don't, it's like math. If you're stuck at one point, you might not be able to finish it. But you being new, or you not knowing the environment, ask your questions, because you don't know what's going to hold you up. Because you might say, I might not know this one thing, but I know how to do the next step. But when it really comes to you having to do a process or do something, you might not know how critical knowing one thing is to the whole thing as a general. I'm sorry if it's kind of rambling on one topic, but I am trying to talk I'm kind of having a conversation with you, to just expand on it, but also try to make sense. But overall, no, not at all. It was not hard for me to catch on to the things that they were teaching me, because I was excited to learn about it. It was fun to me, but also it's just something that you do with practice. Obviously, you're not going to remember the first time, but you having that hands-on experience, it's it becomes a second nature. So yeah, you might not understand what you're doing at the moment, or just be open-minded, and just be eager to learn, and just take it as a learning experience, and don't try to get frustrated or anything. I feel happy thoughts, positive things, and experiences can definitely help you when you're picking up information. But also, if you have the opportunity, or if you have those resources or something to repeat certain things, wrapping, or doing trays, or just picking up instruments, just anything. And with the instruments specifically, because it's I know what all these instruments are now, just one of those, oh, I know what this is. the only thing with that, again, not having any prior knowledge, I can say I practiced on my own as well, but most of it came from me having that hands-on experience and looking for instruments one by one. So let's see, like we had a book. So my first day or first or second day, I had a book. Well, we have like a book with instruments for like trays or separately, just kind of like for guides of every instrument pretty much. So when we had just like time and I was in my training process, what I did, let's say I have a surgery tray and it has 5 instruments that need to be stringed and like some retractors and stuff like that. I would go one by one and find the book, because it's like, imagine having to look for something so much that it's kind of embedded in your brain. Like that's kind of like a study tip for me that helped me, because I would have to look at it one by one and I would just like examine, okay, repeat, like, okay, this is this instrument versus this goes in this tray. Nope, just do the instruments first. Just try to learn the names of them. Maybe going back if you want to look stuff up, or if you have like flashcards or something, that definitely helped. But just literally playing around with the trays and having to log there's okay, sorry, that was the sterilizer from on the other side. Okay, so that was a sterilizer again. I completely forgot where I was, but basically, having that practice within the trays helped me learn the instruments for sure. Because again, when I first got here, I didn't even know what this job was, and now I can pick up instruments and show you what it is. That hands-on experience with them and having to log them, or one by one, I feel like just having that, basically just having that experience with the instruments themselves, you're gonna like pick it up. Anything that you're having that actual experience with and you're having a good positive experience, you're wanting to learn, I feel like it's going to be really, really easy. But that's just my personal experience. I am going to just break, because this is like 7 minutes, so I didn't know. I hope it doesn't come off as rambling, because also there's so many noises. It cut out, but there's literally also so many noises and stuff going on around me that it's like I'm trying to have like a clear mind and give you advice. So I hope it doesn't come off as rambling or it's just all over the place, and I will either make another video or try to just email you and just like keep it short if that's easier for you. But there is this video just in case, but I'm just gonna make it into 2-3 different parts, because clearly I'm gonna talk for a long time. So this is just gonna be answering the first question, as far as like basically just as far as like how easy or hard that I picked up the information.